In this video, I wanted to give you some clinical pearls to figure out exactly where sciatica is coming from in your clients. For those of you that don't know me, my name is Dr. 𝘞𝘩𝘺. I am the creator of the Peak Method and founder of the Soft Tissue Revolution. And basically what we do is we teach manual therapists a new treatment method that focuses on working smarter, not harder, which allows them to cut their treatment times by 50% so they can stay healthy and help a heck of a lot more people get out of pain. So sciatica, the dreaded sciatica. I remember when I was a kid, my grandma would be like, my damn sciatica is acting up. And the problem with sciatica by itself as a problem or a diagnosis is it's just complete bullshit and doesn't really tell us anything. It's what I call one of those junk box diagnoses. So the public's been educated very poorly on the idea of what sciatica is. They usually think if they have any pain in their back, down the back of their leg, into their calf, into their foot. And even when they get it in the front part, they consider it sciatica and they say their sciatica is acting up or their sciatica's out, and doesn't really tell us anything. One thing that I always want to teach people is getting to a tissue specific problem list of what's going on. And sciatica is just one of those very general, very just basic things that doesn't really tell us what's going on. There's a problem there, but we don't know what's really going on because it's really important to take a thorough history. And I'm talking every single time, a thorough history of what's going on with your client. I'm amazed at how many people, especially manual therapists, where the client comes in, they're like, it just hurts here. And you have them jump right on the table and just start hammering away and never really figuring out exactly what's going on. I always say, imagine if you took your car to the mechanic and it was making a noise and you're like, it's making some weird noise. The mechanic's like, all right, let's see what it's got. Just starts hammering and drilling and doing all sorts of random shit. And you're like, aren't you going to run some tests to see what's going on? They were like, nah, I don't need to do that. We're just going to roll right in. This is what you do all the time when you jump right into treatment and not know exactly what's going on, because how in the hell can you fix a problem if you don't know what it is in the first place? And so many people that have gone through my training programs and have worked directly with me, the thing that they shy away from the most is what's called the critical thinking component, like actually using your brain and figuring out what's going on. They just want to jump right into treatment. They never know what's really going on, and they wonder why they're not getting any results. So what they do is they think they need to take more trainings, more treatments, instead of understanding you got to use your goddamn brain and figure out exactly what's going on. If you're watching this video on YouTube, what I'm going to do is I'm going to link up top here. It's the webinar that I made going over the 12 questions you must ask every single time. If you're watching this on LinkedIn, I'll put it in the comments section below. There are 12 questions that I ask every single time before I ever do an evaluation or work on a client or a patient. Those webinars go through all that. But two key components that I'm looking for, especially in the presentation of sciatica. Number one is provocative. So what does provocative mean? Basically, is there something that makes it worse? And then palliative. Is there something that makes it better? What I always want to see in an injury is something makes it a little bit worse and then something can help make it a little bit better. I get really worried and really scared when everything makes it bad and nothing makes it better. That's when I'm thinking big, bad, scary shit like cancer, bone infections, fractures, and things like that. So you always want something that makes it a little worse, makes it a little better, specifically in the diagnosis of sciatica. So what I'm really trying to figure out in this initial history, remember, I'm using my brain and I'm thinking critically, is I'm trying to figure out where is the sciatica pain coming from? Is it coming from the back, or further down in the hips or hamstring, or a combination of both? So let's say it is actually coming from the back. And what I'll see with that in the history, especially provocative, is going to be, it's way worse with sitting, especially after they've been sitting for a while and then they stand up, they like almost feel very unstable and don't feel great. Or when they've been laying on it all night and then they get out of bed in the morning, then I'm thinking this is more of a problem in the back causing the sciatica, and that's the issue that I'm seeing. Now, if it's coming from the hips and hamstrings, a lot of times what I'll see in that provocative is it's way worse with standing for long periods of time and then kind of moving around. They might be someone that's on their feet a lot and they move around, it feels worse. And then a lot of times they'll say, it actually gets better when I sit. So a lot of times when it's a back problem, it's better when they stand, worse when they sit. With a hamstring or hip, it's worse when they stand and better when they sit. So if it's, how do I approach this? Once again, I get to a tissue specific problem list of what's going on. So if it's coming from the back, what I like to focus on in my treatment process in managing this problem is I really focus on the level in the spine from what I call L3 down to the S1 level, the bottom, the top of that sacrum in there. And what I like to treat first is I do a lot of instrument work on the supraspinous ligament. I do some work in the fascia and the erector spinae aponeurosis, and then also a lot of stuff down in like the dorsal sacral ligaments. There's where a lot of like that fascia gets caught in there in between the muscles. Then I go in and do some manual work on the erectors, specifically a lot in the multifidus, right along the spine. They tend to be a really big problem in lumbar spine issues because they're stability muscles. They get overworked. They don't get enough blood flow. They don't get enough oxygen. They develop a lot of scar tissue, a lot of atrophy. And then once I work through that, I actually am able to get in really deep on the joint capsules themselves. They're called the facet capsules. And a lot of times those can mess up the biomechanics of the low back and cause a lot of issues in there as well. So I go through the ligament first, then the fascia, then the muscles, then the capsule. So if it's coming from the hip or the hamstring, my approach is a little different. Where did I write? I have some notes here so I don't get too lost. The most common area in the human body for an entrapment of the sciatic nerve. So nerve entrapments are a really big deal. There's 156 different places in the body where these can occur. They usually present with some numbness, some aching, some burning, and some tension. The most common area for the sciatic nerve to get trapped is in the external hip rotators. Now, little spoiler alert, you're probably going to like, yeah, piriformis syndrome. No, sorry, it's not the piriformis. It's usually something deeper. And a lot of times it's going to be the superior gemellus, because what happens is that sciatic nerve sits right on top of the superior gemellus. It actually goes underneath the piriformis. So the chances of it actually being a piriformis problem is only about 5%, maybe 10%, but being a superior gemellus where all that nerve is in contact directly with that is going to be like 70 to 80%. So I always want to play the numbers and go where it's most common. So a lot of people throw out, those bullshit diagnoses of, oh, you got piriformis syndrome. Just because it hurts in an area doesn't mean there's like 50,000 different muscles in the body. Don't be so simplistic in what you do. So if you're saying sciatica, you're saying piriformis syndrome, you don't have a fucking clue of what's going on. Slow down, ask questions, figure out what's going on. I'm sorry if I yelled at you and made you feel dumb. It's not that you're dumb. You're just being lazy, and you have to get in there and really figure out what the problem is. So a lot of the work that I do in the sciatic nerve and that entrapment happens around that superior gemellus. Then it will get caught up a little bit lower down in the hamstring, especially where they split off at the junctions where semitendinosus, membranosus goes off, and then biceps right in the junction there. About 5 to 10% of the time, I'll find a nerve entrapment in there. Now, for those nerve entrapments, the only way to treat it is with a manual approach. You cannot cup your way out of this. You cannot stretch your way out of this. You cannot dry needle your way out of this. You have to use your hands. You are a manual therapist. Use your hands. And what we're able to do is we put that area, first we palpate it, we find it, then we put that muscle in a shortened position. That allows me to get proper depth. Then I set tension into that scar tissue formation on the nerve. Then the client goes through a full range of motion as I'm keeping proper depth and tension. That is what actually breaks down that nerve entrapment, not your cups, not your stretching, not your dry needling, not your corrective exercises. Use your hands. You are a manual therapist. So a couple lessons from sharing this. I actually made this video this week because I had a client where I was really trying to figure out, it was more difficult. And I really honed in on like, is it worse with sitting and standing or vice versa? And use your damn brain first and get to the root cause of what's going on. Collect and process the data. Form a plan and get the treatment right every single time. And don't default to just going into a bunch of random treatment and see how it goes. Instead, do less treatment, but do the right one, more effective. So that's all I got for you guys in this video. Let me know your thoughts in the comment sections. If it got your brain stimulated a little bit, maybe if I hurt your feelings because I said you're not using your brain as much as you should and you're being lazy. Not trying to call you out, just being honest about what you need to do. You can be better. You can be at a different level than everyone else. You can go grab our free training modules. We go through a lot more critical thinking and problem solving. And lastly, what I want you to continue to focus on is being a clinician first, then a technician. You know, everyone wants to jump into treatment because it's fun and it does that, but they never have any goddamn clue about what's going on. And then they can't figure out why they're not fixing their problem because they never knew what it was in the first place. Don't be like one of those people. Those people are lazy. They're shortcutters. They're not providing value, and they wonder why they never actually get any problems figured out. And they go to every damn seminar across the board and try every type of treatment. You don't need to do more treatment. You need to do the right treatment in the best way. That's all I got for you guys this week. I'll appreciate you, and I'll see you on the next one. Bye.